For me, the most satisfying aspect is the fact that what we do in research can be directly translated into the clinical lab. So in our lab, we're doing translational research, and more often than not, a lot of the stuff that we develop gets transferred into the molecular diagnostic lab at MD Anderson, and patients actually get to benefit from it. In most places, everybody gets to work in their little silo. I feel very lucky to have the opportunity to work in a place where I see both the basic research, I see the clinical research, and I see it being used in patients. So, for example, in our lab, we were able to develop a test that we basically validated in our lab, and then it got transferred into the MD Anderson clinical lab, and now is a test that's offered to patients on a regular basis. I mean, what can be more exciting than that? The opportunities to grow, it's available. I started working at the Translational Molecular Pathology department less than 3 years ago. And I started as a senior research scientist. And at the beginning of this year, I got promoted to the scientific project manager. Everybody's really nice and helpful. That's one of the things that I like about working at MD Anderson, in my department especially, is that people are willing to help. And not just help reach their goals, but we all know what the whole team goal is, and people help meet the team goals, right? So it's not a selfish kind of help. It's let's do this together, and that's what I see in my department, in my little niche. We all help each other to meet a particular goal. If one of my friends wants to work at MD Anderson, I'll just tell them to look at me. I mean, I'm happy working here. I'm doing well. I'm impacting patient care. What else is there? So if they want to be like me, they should come on in.